A first of its kind for Northern California, a new treatment center in Davis opens its doors to help rebuild lives and families of young Native Americans struggling with substance abuse. ABC 10 talks with tribal leaders about the center's unique approach in healing their youth.
The most important thing that is happening that people don't realize is that this is really about restoration of families.
This is Sacred Oaks Healing Center. It provides culturally appropriate substance use disorder and behavioral health treatment to American Indian and Alaska Native youths aged from 12 to 17 years old.
This center has a uniqueness to it that is based in Indian culture, traditional knowledge, and traditional ecological knowledge. If you look at the plants that are all around us, they're all native plants. Quite a few of them are plants that we use for healing.
You also see that culture reflected in the center's design and artifacts.
More than 100 years of historic trauma on Native families, and we have not had the ability to take our kids to regional treatment centers.
Until recently, many tribes in our region have had to travel long distances to Southern California, Oregon, and Nevada. Tribal leaders tell us their teens can be vulnerable to substance abuse because tribal lands can be so physically isolated.
Sometimes there are fewer opportunities. Sometimes there are more influences from people who've been, through historic trauma and suffering from it and haven't found healthy ways to deal with that.
Indian Health Service representatives and members from more than 100 federally recognized tribes in California attended today's ceremony in Davis, celebrating a new chapter in substance abuse treatment.
Providers that have volunteered and stepped up to really understand what that is, whether they come from a Native background or not, we really appreciate their efforts in trying to understand our traumas.
Administrators tell us there are 2 youths in care right now, and 5 have finished the program, and more admissions are arriving soon. The center offers a co-ed residential environment for 32 youth with a 4-month average length of treatment. All potential residents must be diagnosed with a primary substance use disorder by a licensed provider. Treatment services include family therapy, fitness program, cultural activities, and counseling.